This is the first in a series of debates on national and local issues titled ASU Democrats versus Republicans. I'm your moderator, Nihal Krishan, a junior at Arizona State University studying political science and journalism. We are currently filming from a studio on the 6th floor of the Walter Cronkite School of Journalism on ASU's downtown campus. With me today, I have on my left, Austin Stumpf, president of ASU Young Democrats, and a junior at ASU studying political science. On my right is Carlos Alfaro, president of the ASU College Republicans and a senior at ASU studying economics and history. The topic of today's debate is healthcare reform, specifically the Affordable Care Act, popularly dubbed by the media as Obamacare. We had a coin toss earlier, which Austin won, and he will be starting. Austin, your opening statements.
Thank you. I support the Affordable Care Act because it accomplishes the three goals of accountability, accessibility, and affordability. It accomplishes accountability because it prohibits unfair insurance practices such as annual and lifetime caps on coverage and dropping people once they become sick. Now, the only way to accomplish that goal without drastically rising costs is to ensure that the marketplace grows larger and you cover more people. And so the law requires that each individual buy health insurance of some form. Now, they can accomplish that through exchanges that the federal government has set up and certain states have set up, and through the expansion of Medicaid, which some people will be eligible for. And these coverage will be affordable because the federal government has offered subsidies for people to pay for this new coverage.
Thank you. Carlos, we'll have your opening statements now.
Definitely. I oppose the Affordable Care Act, Obamacare, because I see it as hurting the people that it was meant to help. There was three huge promises that made us kind of go the direction of the Obama administration in passing Obamacare. The first one was that people are getting dropped from their plans. So basically, we had the promise that there wasn't people getting enough coverage and that we were going to help these people, and if you like your plan, you're going to be able to keep it, period. No amendments to that. That was his word. That was definitely a lie. Came out and said that that was not true, and he knew it before it actually went into effect that it wasn't true. 4.8 million people have received notices in the mail that their insurance coverage is going to be canceled because it's going to be illegal thanks to the healthcare law. So that was on Forbes. That was the first lie. The second one was that the insurance premiums would not go higher, that we were actually going to save money, that the typical family, the promise was going to save $2,500 under Obamacare. And unfortunately, the Reason Foundation has found, as well as the Heritage Foundation, that 45 states out of the 50 will see skyrocketing premiums, and the families will not save money. The last one is that work will be cut, and that people in part-time jobs will be, or people in full-time jobs will be brought down to part-time, affecting low-skilled workers like myself and students like myself.
Thank you for that. My first question of the debate will be for Austin. Republicans against the Affordable Care Act, like Carlos, claim it to be hugely expensive, say it will cause healthcare costs to go up, and want Medicare created into a voucher system, breaking it up amongst private and public options and letting competition work its will. What do you have to say in response to such claims, and how do you think the Affordable Care Act will solve the nation's healthcare issues better than a Medicare voucher system or the old system that we had in place?
My issue with the Medicare voucher system is that it takes a bunch of people who are on Medicare, which is largely a very relatively a successful and stable institution, and moves them into the private insurance market. And that private insurance market, those pools of people will skew more older and more sick, which will drive the costs up for the people in private insurance, as well as those people in Medicare will now have a smaller pool of people on their own, and so their costs will go up as well. I believe the Affordable Care Act will address these claims because it requires people get covered, and when people are covered, then the uninsured aren't going to the emergency room, and then we're not footing the bill for them. The other issue I have with Congressman Ryan's plan is that it doesn't provide for the uninsured to get covered other than changing Medicare into a voucher system. What do you do for the people who weren't eligible for Medicare anyway? He also takes all the savings that Obamacare creates in his budget, but doesn't keep any of the reforms. You can't have the savings without the reforms.
Carlos, your rebuttal?
Definitely. Well, we definitely recognize that there has been a breakdown of our healthcare system, people not being covered even before Obamacare even came into place. But the problem is that we're not addressing those issues. Those solutions that we sought in Obamacare are not there. In fact, they're doing the exact opposite, affecting the people that it was meant to help by, again, dropping coverage and work hours. But like any other welfare or any program that the government runs where healthcare is involved, for example, Medicaid and Medicare. Since 1964, it was meant to fight poverty and to make people more independent and give them an opportunity to have the American dream. Yet, when it was implemented, 19% of people were under the poverty line. And today, after trillions of dollars spent, hundreds of programs over decades, it has gone down to 16%. So we see it not working. The intentions are there. The intentions are to give people coverage and to make them more independent, but the actual solution and what it's the product of these programs is the exact opposite. I think we have to stop focusing on the intentions and start looking at what we're actually getting from these policies.
Okay. Thank you. My next question is for you, Carlos. In some states, as you mentioned, out of the 45, in 5 states, it does seem to be working well. States like Colorado, California, Massachusetts, where the Republican presidential nominee created Romneycare, which is actually the blueprint for Obamacare, and seems to be working very well. And the argument that Democrats make is that local and state governments that have embraced the Affordable Care Act, promoted it, and tried to make it work in ways that it was intended, are seeing healthcare costs go down and become very affordable, if not cheap. Keeping the website issues aside, what do you have to say about this, and about the fact that if states and their governors specifically supported the Affordable Care Act and implemented it like it was supposed to, perhaps it would work well?
Yeah, and I do see that from the very few states that are benefiting from this, but for the majority of us, we're actually seeing our health care premiums rise. So, for example, you mentioned Massachusetts. They've had a large free rider problem where people have the mandate to go into healthcare, but because they don't need it, people like you and me, very healthy individuals that don't see a reason for getting an extra cost of healthcare, they rather take the fine. But what happens when they get sick is that they take out a policy, they spend 4 times, if not more, of what a regular person would spend on their healthcare. And once they're done with whatever procedure, they drop it. Just implementing a law that says you can't do that is not going to prevent people from actually doing it. These states that have high regulations on the insurance market have seen their premiums rise, and as a product of Obamacare being implemented and these systems being a little more toned down, they're seeing their premiums go down a little bit, but that's only because they were so high up because of their regulations. For all of the rest of us that didn't have those regulations in place, we are seeing skyrocketing premiums, and that's a very big problem for people that can't put food on their table or afford quality health care.
Thank you. So my follow-up to that would be, how do you think that we can get the remaining 45 states on board with the 5 states where the law seems to be working well, or should we be even doing that in the first place?
Yeah, I would argue with that, because I would say that it's not about feeling confident that the law is going to work. It's actually if the law does work. And the consequences is all we should be worried about. And as we've seen in the 45 states, it's not working to do what we designed it to do, so we should definitely call it back. We should tell governors that since it's not working, we should stop the bleeding now and not have to deal with the larger problems in the future and for future generations, but deal with it now. And I would say the compromises that could be made could be done at the state level, and it could be fixed really nicely and with no collateral damage or very little.
Thank you. Austin, your rebuttal?
Well, my issue is that many of these states have the option to set up their own exchanges. The Affordable Health Care Act allowed them to create their own exchanges in order to do things that the states want to do. But many governors rejected that idea, conservative governors, and left it up to the federal government. Now, we know the federal exchange has had some issues due to the website, and now that is unacceptable. Now, the thing about the Affordable Care Act, though, is that this is a long-term piece of legislation. We can't say it's not working because enrollment has only been up for a month and a half so far. People haven't even been receiving coverage from their enrollment yet, because that's not scheduled until much further down the road. So we can't even assess how the law is working after year 1, much less after month 2. Now, I would argue that Kentucky, is a state where only 1 in 6 people are uninsured. It's a state that needs expansion of healthcare the most. And its Democratic governor, Steve Beshear, is fighting to make sure that as much people enroll in their state exchange as they can. And as of October 25th, 24,000 people had enrolled in either Medicaid expansion or the state exchange. I respect the Republicans' disagreements with this law, but you can still fight a law at the legislation level, but you can also implement it at the executive level as well. And if you did that, I think we would see that costs for everyone would, at least the growth in costs would be bending rather than things skyrocketing because people aren't implementing the law like they were supposed to.
Thank you. Clearly, both parties want to accomplish the same goal, which is to improve the state of healthcare in the country, better healthcare services, cheaper costs, and fewer people uninsured. As the Democratic and Republican leaders of your respective organizations on campus, why do you think our leaders in Washington are having such difficulty deciding how to reach this goal of ours? And what compromises can and should we make on each side? Austin, we'll have you go first.
Well, there are 3 reasons why I think this is a hard issue for people to come to terms with. The first is that there are deep interests entrenched, and they fight and they spend money to make sure that the status quo remains. We've been having this debate for 100 years. We've been having this current debate for 20 years, and we finally did something about it. Number 2 is that it's healthcare. These are people's lives. It is supposed to be a hard problem. It's something we feel emotional about, so that's why it's so hard. The third is that the goalposts keep moving. The Republicans used to be far more liberal on this issue. Nixon was for a full employer mandate, which the Affordable Care Act does not provide. Bob Dole had the individual mandate, which is part of Obamacare, in his Republican alternative to the Clinton proposal in the 90s. The individual mandate was a Heritage Foundation idea. So the Democrats keep saying, okay, we'll compromise, we'll take these Republican ideas, and then the Republicans kept moving the goalposts and wouldn't agree to a deal.
Carlos, your thoughts?
And I definitely agree with some of what Austin has said. We do recognize that there's a lot of interests that play into not only healthcare policy, but government policy in general. And that's my main point. Things are hard, especially a complex healthcare economy for one of the largest countries in the world. So because it's hard, I would just echo some of the ideas that Ayn Rand and Frederick Hayek and Milton Friedman said when they were alive, and told us that central planning these things is not going to fix our problems. Having a central board hundreds of miles away, trying to fix somebody's individual health care in California or in Buffalo, New York, or in Seattle is not the answer because they're not there. There's no local knowledge. There's no face-to-face interaction. It's just more bureaucracy, more laws that are restrictive and prevent the market from actually becoming free and solving these problems. My compromise, and I think what a lot of the Democrats and Republicans should recognize is that it's not only that it's inefficient to run it from Washington, but that it's impossible. We need to bring it back to the states where people know their legislator, where people can make change a little quicker, where people can move from state to state. If California wants to have a full welfare system where everybody pays for everybody, they can have that and have the consequences from that. If Arizona doesn't want to have that, people should have the right to say and reject it. But it's only separating it and having the states be the laboratories of innovation for laws on healthcare and the economy that are going to help us come up with a solution, not centralizing it in Washington, D.C. with the Obama administration.
Thank you. We'll now move on to our last question of the debate, which is, as students, how does the Affordable Care Act affect you personally? And how will the healthcare law affect you in a few years' time when you're young adults with jobs? Carlos, we'll have you start.
Yeah, definitely. And I would say I would speak for a lot of the students in my situation. I grew up in a family household that was not very rich. We didn't have a lot of wealth, and I was the first one to go to college in my family. I had to go and work as I was doing my school, and I think this is what a lot of students are doing and what has showed me a lot of my work ethic, and it's actually very beneficial. But because of this law, we're now forcing employers to cut hours, to cut benefits from low-skilled workers and people that are working minimum wage hours. For example, Forever 21 and SeaWorld, who hire many college students from across the country, they're dropping their full-time employees to part-time because they don't want to pay that fine or that expensive health care that comes with Obamacare. Places like Trader Joe's and Home Depot are dropping medical coverage for their part-time employees. So even if you were part-time and you were getting employees, these companies are trying to provide something, and this health care law is preventing them from doing that because it raises costs so much that it eliminates jobs and makes their costs more expensive.
Thank you. Austin, how has the Affordable Care Act affected you personally?
Well, the Affordable Care Act affects me personally because I have a pre-existing condition. I have Crohn's disease, which I've been dealing with for 7 years. Now, luckily, I'm fine for the most part. I take my meds, I'm fine. But if the worst should happen, or if I should get sick, I'm very glad that the Affordable Care Act's in place, that the insurance company can't drop me from my coverage as soon as I get sick. I'm also very thankful that students and just young people of all professions get to stick on their parents' plans until they're age 26. The job market is tough for graduating students. It's especially hard to find a job that will provide you health insurance. So being able to have that coverage until you're 26 is essential. And the third thing is that the nonpartisan Congressional Budget Office has stated that this law, it originally predicted that the law will reduce the deficit by $143 billion from 2010 to 2019. And its cost estimates since then have shown that the costs of the law have been lower than they originally predicted. So we are saving more money than they originally thought we were. This has been one of the single largest drivers of deficit reduction in the last several years, and it projects to continue to be so in the next several years. If we care so much about the deficit, we should at least see how this law actually affects the marketplace.
Thank you. We'll now be moving into our closing statements of today's debate. Carlos?
Yeah, okay, so the first thing I would say is that rushing into a law that already shows significant problems is only going to make the problem worse. And people, not only in the Republican side, but all over are recognizing this. There's a Washington Post that quoted a recent poll from Quinnipiac University. They showed that on October 1st, 45% of people approved of the Affordable Health Care Act. And now, which was November 13th is when this was published, that dropped down to 39%. Opposition for this law over the same amount of time has gone up from 47% to 55%, which shows that people are realizing when they're getting these notices in the mail and when they're getting their hours cut and money not on the and food not on the table, they're realizing that it is a direct result of this law and of politicians and government bureaucrats trying to tell them what decisions to make. It's irresponsible, and we should fight it at every step. I think we need to also realize that government can't fix all our problems, and that the marketplace is a much better place to find solutions for complex issues like healthcare.
Thank you for that, Carlos. Austin, your closing statements?
My closing statement is I think that if you are not covered, make sure to get covered. It's unfortunate that millions of people are getting cancellation notices, and it was gross oversimplification by the administration to promise that if you like your plan, you can keep your plan. That was largely made for the employer market, but extended to the individual market, it just doesn't work. And they knew it didn't work, but they still said that as a talking point, and I'm glad the president apologized for it. For those people who have had their insurance canceled, I would say look into the options you have. For the most part, the vast majority of people who have had their insurance canceled will be able to purchase better plans on the exchanges, and they will also qualify for subsidies to pay for those plans. There will only be a very slight group of people who will have to pay more than they would have originally. As for the employers who are reducing people's hours, I just think that's a poor business decision. The law is asking them to provide health care for their employees, and in many situations, that's actually cheaper than reducing their employees' hours.
Thanks so much for your answer, Austin. This brings about the wrap-up of our debate. As the presidents of your respective organizations on campus, is there anything that you would like your viewers to know, Carlos?
Definitely. I would like people to come to our meetings. College Republicans meets on Wednesdays at 6 p.m. We have discussions on not only healthcare, but the economy and immigration. And we also bring speakers from all over the state and the country to come speak to us about these issues. So I hope people will be encouraged, even if they're not Republicans, to come and join the discussion.
Thank you. Austin?
Hello, everybody. Our club, the Young Democrats, has lots of great discussions on issues as well, and we bring lots of great speakers, especially candidates and legislators, to the table for people to have direct access and ask questions to. In fact, this Friday we've got Attorney General candidate Felicia Rodolini scheduled at our meeting. Our meetings are every Friday at 3 p.m. in Discovery Room 150. I hope to see you all there.
Thank you so much for joining us today. And stay tuned for our next debate on immigration reform. This is Nihal Krishan signing off from the Cronkite School.